The human brain is an amazing, amazing organ. The brain is what makes us human beings. It's what makes us interact with other people, have our emotions, fall in love, be angry.
Brain is the most complex organ a human has. The brain also controls your heart rate, your breathing, your walking.
The human brain is what allows us to literally do everything we do every day.
So any small interruption in the brain can lead to some of these conditions where patients are paralyzed or they can have seizures.
I have a unique opportunity to take care of patients that usually when they come to me, they're having an emergency and their brain is not working. They're paralyzed on half of their body, they're mute, they cannot talk, and we do procedures to help reverse those symptoms and get them back to normal.
I had a brain aneurysm rupture. I was healthy. I never expected that something like that would happen to me.
When you have a brain injury, there's so many unknowns that come from it, and there wasn't one interaction with Dr. Smith that I didn't know that I was in the best hands possible.
So Mainline Health is brilliant people who works as a team that helps to treat this complex organ system, whether it's stroke, whether it's brain aneurysm, or any neurovascular condition.
The Neurointervention program at Mainline Health is absolutely phenomenal. We do this minimally invasive procedure to undo the stroke and restore your function. The type of procedures that we do are extremely sophisticated and complicated. Mainline Health does this so well, so safely, efficiently, so that time is brain.
I feel very fortunate to have had care at Mainline Health. I can't imagine that I would have received better care anyplace else.
Here at Mainline Health, one of the unique things about neurointervention and neurosurgery is that we are Jefferson here at Mainline Health. Every single doctor who performs neurosurgery is a Jefferson physician. Not only do we have great training and cutting-edge care, which Jefferson brings, but we also have immediate access to all of the clinical trials that Jefferson has ongoing. Neurointervention is a minimally invasive way to treat conditions of the blood vessels of the brain, and sometimes of the spine. It's truly revolutionized how we do our brain surgery.
With this minimal invasive catheter-based procedures, you can enter through the arteries to a small hole, and we can reach to the clot using a specialized biplane machine and retrieve the clot out. With the biplane machine, you are able to navigate through this complexity without causing any harm to patient.
Working at Mainline, not only do we have the equipment, but we have an entire program to go along with that to make sure that we're taking care of patients each step of the way. But after that, they head to our ICU, where we're also doing cutting-edge neurocritical care, recovery, rehab. I think the continuum of care and the multidisciplinary program is very unique to Mainline.
Through the Neurointervention program at Paoli Hospital, we are able to provide this world-class care for our community.
We are just so excited that we've been able to open the Neurointervention program at Paoli Hospital locally. It's very rare to have this type of sophisticated program and equipment and physicians and team in a community health setting. And if you're having a brain emergency that requires neurointervention, really every minute counts.
We can basically treat all the complex neurovascular conditions at Paoli Hospital. Patients can get their stroke treatment, their aneurysm treatment, or any other neurovascular conditions at Paoli Hospital.
Living in Chester County, knowing now that Paoli has a neurointervention lab is very meaningful. Timing is everything with the rupture of an aneurysm. And knowing that the community has a neurointervention lab right here is such a gift.
The neurointervention team not only saved my life, but they also gave me back the quality of life I had before I had the brain aneurysm.